Close your eyes and imagine you are playing in the park with your family and friends, and all of a sudden you have a tremendous pain in your chest. It feels like there's an elephant sitting on your chest and there's nothing you can do. Your family and friends are standing around you, trying to figure out what they can do to help, but there's still nothing they can do. Then you collapse and everything is closing in on you, and it is extremely difficult to breathe. Then you're gone and dead. This all happens in a few minutes. I can bet none of you watching this video want this to happen to yourself or your family. Hi, I'm Chris Pennock and I'm a firefighter paramedic and wanting to discuss important information about heart attacks and strokes with you. I'm going to inform you on the causes, warning signs and symptoms, and what you can do to help prevent heart attacks and strokes. So let's begin with what a heart attack and strokes are. But it's crucial to be educated about heart and brain before understanding any of these complications. The heart is split into four main parts. It's the right atrium, right ventricle, and the left ventricle. The heart is also supplied with blood from your coronary arteries. That's the basics of the heart, and next I'm going to talk to you about what a heart attack is. According to the University of Maryland Medical Center, definition of a heart attack is, a heart attack occurs when blood flows to a part of your heart that is blocked for long enough time that part of your heart muscle is damaged or dies. And another name for a heart attack is a myocardial infarction. Doctors and health professionals typically use this term. Now that you know what a heart attack is, I can tell you what some causes are that lead to heart attacks. Here are a few causes of heart attacks. Coronary artery disease. It's a buildup of plaque in the artery walls. Cholesterol plaques by a process called atherosclerosis. A clot will form if a plaque ruptures, or if there is so much plaque buildup in your artery walls of your heart that blood flow decreases or completely stops. Another one is arteriosclerosis. The definition of WebMD is the hardening of the arteries. It prevents the heart and arteries from expanding and giving adequate blood supply. Some of the causes are, both of these actually have the same symptoms, are caused by smoking, drug abuse like cocaine, bad eating habits like fast food, McDonald's, all that junk food, lack of exercise. Sometimes it's hereditary family or a history of heart complications, and high blood pressure causes the artery walls to become weak and hard and overworked. And high cholesterol contributes to plaque buildup. So, what is a stroke? Cerebrovascular accident, that's what it is actually. According to the American Heart Association, the two main causes of strokes are blood clots that dislodge and get stuck in the brain. This is called an ischemic or an embolic stroke. Similar to a heart attack, the brain cells die when there is a lack of oxygen. When a vessel in your brain bursts or vessel expands like a balloon, putting pressure on the brain, this is called a hemorrhagic stroke. That's another stroke cause. Some of the causes of strokes are diabetes, smoking again, high blood pressure, and high cholesterol. Some preventions that you can do for heart attacks and strokes are easy. Quit smoking. No one should smoke ever. Such bad for you. Eat healthier, like a lot of greens. Stay in shape, work out at least 3 to 5 times a week, and monitor your blood pressure levels and your cholesterol levels. People can do everything possible to prevent heart attacks and strokes and still have them. So you need to know the symptoms of both. Some warning signs and symptoms of heart attacks are chest pain, also known as angina, lasting for an extended period of time that comes and goes, and pressure or tightness in the chest. You can have pain in your arms, neck, back, jaw, or your stomach even. Often it's just radiating down your left arm for the pain. You have breath shortage, you have nausea, fainting due to the lack of O2 in your body, you have cold sweats, which is also related with clammy look, like a ghost like you're all white and pale. Some women also only may complain of fatigue. So finally, let's look at the signs of strokes. Warning signs and symptoms of strokes are sudden numbness or weakness, paralyzed on one side of the body, confusion, severe headache, and loss of balance or dizziness. And you have a lack of sight sometimes on one side of your eye or both eyes. So, hopefully you understand all the signs and heart attacks of stroke. Early detection can save your life or your family's life. I have given you some helpful information about heart attacks and strokes. I have covered many causes, warning signs and symptoms, and what you can do to prevent them. I hope you've learned a little about both subjects and it will help you in the future. Remember, you do not want to be that person standing in the middle of the park with your family around you, dead, and no one else can do anything about it. Thank you.